Hello guys, my name is Dr. Khanna. I'm going to talk about breast density today. I know you may have, a lot of you get letters from us saying you have dense breasts or you have fatty breasts. So I'm just going to talk about that a little bit. I'm going to show you some images to explain better. So let's get started. So basically we have two main tissues in the breast. One is the glandular tissue which makes the milk, and then you have a fatty tissue. So depending on how much glandular tissue you have and how much fat you have, we classify the breasts into four categories. The first one is called the fatty breast, where most of the tissue is fat and there's very little glandular tissue. Number two is what is called scattered fibroglandular elements, where there is small amount of glandular tissue and still majority of the tissue is fat. Then we have heterogeneously dense breast tissue, which is a lot of glandular tissue and less amount of fat. And finally we have extremely dense tissue, which is pretty much a lot of glands and very little fat. So I will show you the pictures. I will show you how everything looks on the mammogram. And why is it important? Because if you have the cancer happens to be bright or white on the mammogram, and so is the breast tissue. So cancer can easily hide in a dense breast when compared to a fatty breast. So that's why it's important to kind of put the breast in one of these categories. So let's get started. So this is a case of a patient who has what we call is almost entirely fatty breasts. So you can see most of the tissue is kind of gray. There's very little white stuff. The white stuff here is basically the glands, and all this gray area is the fat. So it's very hard for cancer to hide here. So let's see if this is a area that looks a little denser than the rest of the breast. So that could be a potential cancer. So I think this was biopsied. You can see the clip here, and this was benign. So this is how a kind of fatty breast looks like. And I'll show you another case here. This is another example of fatty breast. You can see there is very little tissue here. You see some tissue, but most of what you see is pretty much fat. So that's the category one, predominantly or almost entirely fat. So here you can see, actually this is an example of scattered fibroglandular density. This is the type 2, and you can see there's a lot of kind of white stuff here, which is just your normal gland, and all of this is just fat. So there is still a lot amount of fat, but there is some glandular tissue. So this would be a category B. Here is another example of the category 2, which is scattered fibroglandular. You can see all the white stuff is gland, and all the gray stuff is the fat. And you can see this is a little bit denser than the first case that I showed you, this one. So next we are going to go to one of the most common categories, which is category 3, which is basically heterogeneous fibroglandular elements. So you can see there's a lot of breast tissue here. There's a lot of white stuff, which is glandular tissue, and there is not very little, but there is kind of less amount of fat when compared to the rest of the breast. So this is one of the most common categories that we see every day. And the reason that this is important is because if there's something white here, like I said, cancers can look white. They can easily hide in this tissue and may be difficult to find. So let's look at another example. This is another category 3 or heterogeneously dense breast, and you can see there's a lot of white stuff going on here, a lot of glandular tissue and less of fat, making it difficult to find cancer. So that was this. And so now we come to the last category, which is extremely dense breast. And you can see the example here. There is a lot of white stuff, and you can easily hide a cancer in this tissue. So that's why it becomes important. And especially on 3D mammogram, it's more helpful in finding breast cancer in dense tissue. So this is a dense tissue. This is the category 4, or the extremely dense breast parenchyma. And in patients like this, we kind of encourage supplemental screening, which may be with ultrasound or MRI. And so these were the 4 categories. as per the American College of Radiology. Hope you enjoyed the talk.